Hello, Becky Hosey here again. Thank you for joining me. We are going to be starting a series of videos on medical gaslighting. And today's video is an introduction, so just an overview of the topic. So let's get started. The buzzword gaslighting is something that you may have heard over the past few years, but what does it actually mean? So most dictionaries actually define gaslighting as psychological manipulation or psychological misleading, which is all intentional. And many examples actually outline clear roles of an abuser and a victim. The impacts of this psychological manipulation land the person that is gaslit into actually questioning their feelings, questioning their thoughts, their perceptions. So pretty serious stuff. And what does this mean in the medical realm, in healthcare? So there is something called medical gaslighting. And this is pretty broad. There are kind of a lot of examples of this, which we'll talk about just some of them. Probably the most obvious, definition is that your provider is ignoring you, ignoring your concerns. So you go to the doctor, you're not feeling well, you have a concern, and they totally dismiss you, totally disregard your concern, your symptom, your issue. That's probably the most obvious definition of medical gaslighting. But let's talk about some other scenarios that it's still medical gaslighting. Let's say you go to the doctor, you're not feeling good, and your provider maybe seems like they're fairly concerned, they're engaged, they're listening, they even order some, say, tests. But then when you see them back for follow-up, your tests are normal and they say there's nothing wrong. Then what? Well, this is also an example of medical gaslighting. Let's take it a step further, and maybe you say to the provider, I'm still not feeling well. Can you order more tests? Or can you refer me to maybe someone, a specialist that could help? And they refuse. They say they don't believe that there's anything wrong. Maybe they'll even say that it's all in your head, that it's imagined, that there's nothing wrong with you. But clearly you know something is not right. So, or let's just say that some of those lab tests came back abnormal. Maybe the provider says they're not abnormal enough, even though you're still telling them that you're sick. I had many stories of medical gaslighting. But one in particular I would like to share with you. In 2015, when I was really struggling, I had this mystery illness and was bedridden at times. I ended up getting some lab tests done, very specialized lab tests, and one of the lab tests came back 4 times what the normal limit is for normal, right? And the provider said to me, this is not significant. And I said, well, I actually have all the symptoms. And now I have this lab test. It's kind of not, really rocket science. You can put it together, right? And she said, well, I would only consider that to be significant if it was over 8 times the normal limit of the lab. That's just insane. When I tell people this story, they just cannot fathom it. They can't wrap their brain around it. So I did a bunch of medical research, and there's nothing scientific behind this except that she didn't want to, diagnose me or do further investigating or what have you, or who knows. But in any event, that lab test to me meant everything. That meant validation for months of suffering. That meant a name to, to give my symptoms, a disease name. That meant potential treatment and better quality of life. So, let's say that your provider just doesn't have an obvious answer. In my case, it was obvious, but let's just say that all your tests came back negative, they're all normal, but you still feel terrible. Now what? Your provider's dismissing you, they're medically gaslighting you. Now what? I want you to understand that us medical providers have a responsibility to investigate our patients' concerns and symptoms. We have a responsibility. And this investigation is not always easy. So some providers may just medically gaslit their patients because it's just easier, right? Investigating an illness could require a lot of research. It could require referrals, co-management, with other providers. It's time consuming. It takes effort. And for someone that's already overwhelmed, they just don't want to do it. Sad to say. They don't belong in the medical profession. The other aspect of this is that providers don't necessarily like to admit that they don't have all the answers. I find that just being honest with patients and saying, I really don't know what's going on, but acknowledging what's happening. So acknowledging that you are sick, that you are not feeling well, but that I don't have all the answers. I think that lends patients to have so much more respect for providers. And, taking that a step further by saying, I will do research. I will refer you to someone that can help. I'll talk to a colleague. I'll try to, investigate. I mean, that's really what it takes to show that your provider cares, instead of just saying, there's nothing wrong with you, it's all in your head, right? It's much easier, isn't it? So medical gaslighting really is an epidemic, but it's just starting to be talked about, which is just sad. It's so common. And honestly, we have to keep the discussions going, because we need to bring forth this issue in not just the community, but also in medical education programs. I am committed to medical excellence, and I want to eliminate medical gaslighting. I want to put an end to it. So I speak to our future medical providers about medical gaslighting, and I think my story is pretty strong because I'm one of them, but I'm also a medically gaslit patient. I also remind them that they are not dealing with physical items on an assembly line belt. These are human beings that deserve attention, deserve compassionate, competent healthcare, which is a fundamental human right. So, also in my talks, to these, budding health professionals, I tell them very candidly that marginalized groups, which are susceptible to medical gaslighting, be it gender disadvantage, racial, socioeconomic, education, there's a laundry list. But they have good reason to mistrust us. We have a very bad track record And, unfortunately, um, medical gaslighting is one of these issues that's allowed, even though it's medical misconduct. It really is. In my whole medical career, I've only seen one health provider be reprimanded for medical gaslighting. And actually, that was a long time ago. It wasn't even considered or called gaslighting at that time. Just, I believe he was minimally reprimanded for just not listening to his patients. That's sad. Very sad, because if you just poll, poll the United States, I can only imagine probably everyone has been medically gaslit at some time. Some more often than others. This is a very serious violation of trust. It's dangerous, it's abusive, and obviously the physical impacts of misdiagnosis, which could lead to severe suffering, death. But what about the emotional impacts? Let's talk about that. I almost feel like they leave, the deepest wounds, because it creates this inner turmoil. So here you're seeing this medical provider, this trusted medical provider, and you believe that they have your best interest in mind. You are under the impression, right, that they're ethical, right? They've all taken this Hippocratic oath, this first do no harm, that famous, rite of passage, and you expect that they will be there for you to help you at your most needed times, right? And what that can do to you emotionally, psychologically, is very, very significant. I mean, it can really just make the most confident person really question their own thoughts, feelings. I mean, the impact of that is just extraordinary. I mean, trust me, I've been there. I was, right next to the fire, I can tell you, and I felt the heat. I really got burned by some flaking embers, okay? So I've told you this before, and I'll ask you again. I'm pleading with you, please trust yourselves. Don't give up. If you know something is wrong, don't give up. Keep pushing for answers. Keep pushing for answers. Don't doubt yourself. Ever. Don't waver. Use your intuition. Follow your intuition. I promise you, there are many, many, many good providers out there. Just like any profession, there are good, there are bad. And I know sometimes it can seem like, boy, I've seen, 3 providers and they all dismissed my concern, and I know that I'm not well. It can be really frustrating to keep going. And I hope through, awareness with my videos and such that I really can inspire you to just never give up. There are good providers out there. There are, and I will help you to seek these out. There are. They will give you the attention you need. They will listen to you. We'll talk about so many things to look out for during your visits and what you can do. So you're not just a helpless patient. Okay, I'm going to teach you what to do if your provider's just typing away and not listening, or if they dismiss you. Never settle for anything but the best healthcare. You deserve it. So that's all for now. Future videos, we're going to get into rationales behind medical gaslighting. We'll talk about what to do if you are being medically gaslit or have been, or a loved one is. And like I said, it's just such an epidemic. I'm sure everyone has experienced this. So don't forget to like and subscribe. I think the more that I get people interested, the better it will be, because just getting my story out there, and again, I just wanna be able to help people and just remind them that they're not alone. If I myself, a medically educated healthcare provider, had so much trouble navigating the health system, sometimes I think, being medically gaslit, it's just, or gaslit in general, right? So just isolating you, but this is just so common. And if I had this issue, then no doubt that others that are more disadvantaged than I will have this issue. So be well, and thank you again, and we'll see each other soon.